Hair loss can be a frustrating experience. It affects both men and women. But what if there was a way to restore your hair and your confidence? Enter hair transplantation, a procedure designed to combat hair loss and restore a fuller head of hair. Imagine a farmer planting seeds in a field. That's similar to how a hair transplant works. In this procedure, hair follicles are taken from one part of your scalp called the donor area. These follicles are then carefully transplanted to the area experiencing hair loss, known as the recipient area. The transplanted hair follicles are genetically programmed to continue growing hair. This means you'll have natural-looking results that can last a lifetime. It's like giving your hair a second chance. Hair transplants have become increasingly popular. This is because they offer a permanent solution to hair loss. But before you jump in, it's important to understand the different techniques involved and whether you're a suitable candidate. When it comes to hair transplants, two primary techniques take center stage: FUT and FU. Both methods achieve the same goal, transplanting hair follicles, but they differ in their approach. FUT, short for follicular unit transplantation, involves removing a strip of scalp from the donor area, usually at the back of the head. This strip contains thousands of hair follicles. Technicians then carefully dissect the strip under a microscope, separating it into individual follicular units for transplantation. On the other hand, FUE, or follicular unit extraction, takes a more meticulous approach. Individual hair follicles are extracted directly from the donor area using a specialized punch tool. This leaves tiny, almost invisible scars. These extracted follicles are then transplanted to the recipient area. The choice between FUT and FUE depends on various factors, including your hair characteristics, the extent of hair loss, and personal preferences. Your surgeon will recommend the most suitable technique based on your individual needs and goals. Not everyone is an ideal candidate for a hair transplant. Several factors come into play, and a consultation with a qualified hair restoration specialist is crucial to determine your eligibility. Firstly, the cause and pattern of your hair loss are essential considerations. Hair transplants are most effective for those experiencing androgenetic alopecia, also known as male or female pattern baldness. This type of hair loss follows a predictable pattern. Secondly, the availability of sufficient donor hair is crucial. A healthy and dense donor area ensures an adequate supply of hair follicles for transplantation. The surgeon will assess the quality and quantity of your donor hair during the consultation. Age is another factor to consider. While hair transplants can be performed on individuals of various ages, younger patients might need to wait until their hair loss pattern stabilizes. Additionally, overall health and any underlying medical conditions are taken into account to ensure a safe and successful procedure. Unveiling the results and recovery timeline. After the hair transplant procedure, patience is key. The transplanted hair follicles need time to settle in and begin their growth cycle. While you may experience some initial shedding of the transplanted hair, this is entirely normal and part of the natural healing process. Within a few months, you'll start to notice new hair growth in the transplanted area. This hair will initially be fine and thin, but will gradually thicken and mature over time. The full results of a hair transplant are typically visible within 12 to 18 months. You'll be able to enjoy a fuller, natural-looking head of hair that can significantly boost your confidence. Recovery from a hair transplant is generally well tolerated. You may experience some mild swelling, redness, or discomfort in the days following the procedure, but these are temporary and subside quickly. Weighing the costs and considerations. The cost of a hair transplant can vary significantly depending on several factors, including the chosen technique, the number of grafts required, the surgeon's experience, and the geographic location of the clinic. It's essential to approach hair transplant costs with a holistic perspective. While it's tempting to opt for the cheapest option, prioritize quality and expertise over price. Remember that hair transplantation is a delicate procedure that requires specialized skills and experience. When choosing a clinic, thoroughly research their reputation, credentials, and patient testimonials. Schedule consultations with multiple surgeons to compare their approaches, costs, and financing options. It's also crucial to have realistic expectations. Hair transplants are not a quick fix. and results take time to become fully visible. Patience, proper aftercare, and open communication with your surgeon are essential for achieving optimal outcomes. Your path to hair restoration: seeking expert guidance. If you're considering a hair transplant, the first and most crucial step is to consult with a qualified and experienced hair restoration specialist. They will evaluate your individual needs, discuss your goals, and guide you toward the most suitable treatment options. Remember that every individual's hair loss journey is unique, and there's no one-size-fits-all solution. A skilled surgeon will tailor the procedure to your specific requirements, ensuring natural-looking results that blend seamlessly with your existing hair. Hair transplantation can be a life-changing decision, restoring not just your hair but also your confidence and self-esteem. By seeking expert guidance, understanding the procedure thoroughly, and setting realistic expectations, you can embark on your path to hair restoration with confidence and optimism.